is Orji Elizabeth is a registered dental therapist who is a co-owner of Family Dental Clinic. She works part-time at Primary Healthcare Center, Wuro Sembe, and carries out outreach at the Mambila Plateau with American missionaries. This morning, she will be presenting on the topic how to gather oral health data in the clinic. Madam Elizabeth, you are highly welcome. The floor is open. You can go ahead and make your presentation. Thank you.
Thank you, everyone, and good morning. I will be giving my presentation on the topic how to gather oral health data in the dental clinic. I will begin by explaining the abstract that I wrote. And the abstract tends to look into the 3 levels of oral health: data availability on respect to patient healthcare providers, researchers, academias, and policymakers. You should also note that a major problem with data collection is data quality. So I would actually explain how to gather data. If you look at the topic, it's basically on a how to. So we'll talk about how to gather data effectively in the dental clinic. So I'll move next to my introduction. Data collection is not up to par in that respect. In terms of collecting data, we are not actually being effective in doing that. We would also look into topics like questionnaire down to artificial intelligence to explain how we can be able to collect data effectively in the dental clinic. So I'll move next over to my next slide, which is the materials and methods. On the slide, you realize that I outlined 4 materials and methods, which are questionnaires, using of mobile applications, using of patient folder, and also artificial intelligence. So the first topic I mentioned is questionnaire. Questionnaire is just a set of printed or written questions with a choice of answers, especially for the purpose of survey and statistical studies. Most times we print out these things and we distribute it among professionals, amongst laymen on the streets, even to our patients and all that, just for the sole purpose of gathering data. So if you look, there is an image below when you go to the next slide. That image below indicates how data can be collected. That's what you can find on the image there. So next is mobile application. I know we are very conversant with our phones, and both it's a shock that a lot of times we don't know that our mobile phone can actually be used to collect data. Presently in Nigeria, we don't even have anybody with an oral health data collection mobile app. So I think the only one I've seen online when I was going to do my findings was the one that was very effective. A lot of people recommended was what they call the brush DJ. So you could realize that the mobile application is phone related, where apps are downloaded. You download these apps on your phone with the propensity to retrieve data from the activity of the app users. So as you brush, I think that brush DJ, which is an example I mentioned, is basically about how to track your brushing and how to effectively use the data collected from the way. Like, you can be able to tell patients that brush twice a day and those that don't brush twice a day. Patient that can brush up to 2 minutes and patient that doesn't brush up to 2 minutes. So this data collected by this mobile app can be used to do what? To propagate maybe a research or any project one might be trying to embark on. So when you are done with mobile, I'm done with mobile application. So I told you this is actually a how-to, so there's no much of explanation. A lot of things is self-explanatory. Patient folder. A lot of us are professionals here, and we gather folders. We gather information from our patients in our patient folder. So these information that are gathered, most times we pile them up. We only use them for reference purpose. Maybe when the patient comes back another day, we can be able to retrieve the patient folder, know the patient's last history, and be able to update and be able to treat the patient on when we are doing continuous treatment. But this patient folder is also a very big tool in gathering data in the clinic. If this patient's folder can be shuffled by academians, by professionals, by even someone who's not even dental related, you can put information together. You can be able to get a correlation that can be used to further a certain research or a certain conditions. So that's that about patient. Although this data gathered are just hypothesis, you can't say it's actually a proven fact. So we are not going to use data gotten from patient folder and actually finalize that is actually a proven fact until it goes through other steps. Now I'm down to the fourth point, which is artificial intelligence. Artificial intelligence is something a lot of us think is just a very big word and very vast and cannot really be related to our profession as dental professionals. But I tell you, artificial intelligence can speed up a lot of things for us. Now, data collected using artificial intelligence can facilitate the transition of basic and clinical research to permit human clinicians to find the best modalities for their patients. Because this artificial intelligence, it might be a software, it might actually be a model, or let's say like a small robot placed in your office. It's going to get data from your patient, correlate them together, and be able to tell you a certain pattern that you can expect from a patient with this kind of condition. Those patterns can be put together, and this data is gotten from these maybe robots or softwares or algorithms, as we do machine learning, as the case may be. We call those things the robots do, or those software do machine learning. The machine is actually learning a pattern that you're undergoing that machine, undergoing it into. So it begins to correlate information that when a patient walks in with dental caries, he can be able to tell you if it's class 1, class 2, class 3, because of it's learning to be able to identify these issues. It makes diagnosing patients faster and easier and more accurate for you. Because sometimes as professionals, we might be so tensed or into our own self that we might not actually give right diagnosis to our patients. But this is where artificial intelligence comes in. This data that is being collected from artificial intelligence by these machines can be put together, and we can also term it to be data collected from the dental clinic. So when we are done with artificial intelligence, I will also say this data that has been collected can also be used for our cause. Let's say we are trying to propagate effective toothbrushing, but people will say, nah, it's not important. But if we can put together this our data and show the world that from data collected, brushing is very important. When we take it maybe to the necessary authorities, those that make decisions, we can be able to back our statement with facts, because we've collected this data, we follow a trend, and we know how these things are done and how lack of brushing can actually affect the oral health of a patient. So with these data collected, we can be able to do what? Make the government to become more proactive in passing out a law or a statement that will help propagate toothbrushing. That's just an example I'm giving. So we are down to ethical statement. Now, after all this data is collected, how can I know that I am not overstepping my boundaries as a professional? I am not going beyond my own scope of study. I think a lot of times we overstep our boundaries. That is why you have to get your ethical statement in order. You can get your ethical statement by passing your work through international organizations or your local organizations. Let's say the Nigerian Dental Therapists Registration Board of Nigeria. You tell them, I'll put together this data. I'm giving it to you, so that you can be able to know if I am within my scope of study to continue with my work, to continue with this research I've put together, this data that I've gathered. Can I continue with it? So this is where ethical statement comes in. This is where your professional bodies can assist in making sure that you work within the ethics of your profession. Now we are down to statistical or data analysis. These data collected are not without fail, or they are not absolute. So because they are not absolute, you should be able to come up with quantitative as much as you can. You should be able to come up with qualitative studies that this thing that you have analyzed to a large extent, not completely, but to a large extent, is beneficial and important. Now, these organizations that I mentioned earlier, maybe Nigerian Dental Association or FDI or whatever, will now take this data, since this data is within your scope of study, we can now further analyze this data to know if it's beneficial to our profession, and how we can be able to take this data and be able to analyze it effectively to get a desired result. That is where we get to our next point after we are done with statistical statement, and that is the result. Sometimes when we are done with our data collection, we might find out that what we actually have in mind didn't really work out. Let's say I'm trying to understand why brushing older people is very important. And maybe when I'm done with gathering my data, I realize that brushing older people is not important, for example. So I can be able to counteract all what I've done. That is where your result is telling you that the work you have done, you have a negative answer. Or I've been able to go through this research. I am done with going through this research. And the result I've found that is brushing in elderly people beyond 60 years is very important. Though that is the result, you can now be able to bring up this data you've accumulated through these steps that I've mentioned, through this process that I've mentioned. You can be able to say this is the result. I am sure if you follow through these my steps, you do your own research, you will still get the same result. I think that is what result is all about. Being able to, the end point of all these whole processes that we've been going through, what is it about? That is where the results come into place. Challenges. What are the challenges you face during data collection? There are so many challenges, especially patients. Sometimes patients are not being truthful in what they tell you. Someone walk into your clinic, he's clearly 40 years old, he'll tell you he's 29. So you can also see patients who come into the clinic because they feel that if they tell you all their problems, you charge them more. They tell you less of their problems. So your data cannot actually follow a pattern that you want to get. You understand? So that lack of trust and confidence in the health sector is an issue that we face as professionals who want to gather data. And also on the side of the professionals, we are always in a hurry to gather this data. We give ourselves shorter time frame to gather this data. And we are in a hurry, so we do haphazard work that is not very effective, cutting short on standards and on every other thing. So this gap that we've created in terms of collecting effective data and not collecting effective data is one of the challenges we face. Finance is also an issue, and be able to get professional bodies to back your research is an issue. So that finance is an issue that we've gotten. And also, is your government proactive enough to want to carry out those? Say, we are dealing with hunger for now. Why are you telling me about it? So that's also another challenge where a lot of people might be complacent in trying their best to gather data. In conclusion, the future of data collection in dental clinics, we have to combine more than one method. If you want to effectively carry out your research using data collection, you have to use more than one means. These data collection methods are listed, about 4 of them. You combine 2 methods, you get a more accurate process of collecting data in the clinic. And you should understand that the reason why you are collecting this data is to be able to help the population and help the government and other relative bodies make better decisions in terms of resource allocation and research decisions. Thank you so much, and I think I am done with my presentation.